Some new treatment guidelines for the more than 14 million obese children and teens in the United States. The American Academy of Pediatrics now recommends aggressive therapies like pills and surgery early on as long-term remedies for weight loss. A new guideline moves away from watchful waiting or delayed treatment to see if kids outgrow obesity. And joining us tonight with his reaction to this move is Tristan Justice, author and staff writer at the Federalist. Tristan, great to see you. First off, your thoughts on these new guidelines.
Well, we're really teaching children the wrong message, and we keep treating symptoms as opposed to the disease itself. And so, look, over the last 100 years, Big Pharma has really grown addicted to treating symptoms and treating symptoms of disease as opposed to curing or even preventing disease, since that makes far less money than for Big Food and Big Pharma. And so we're teaching kids they can continue to eat however they want and live however they want and not exercise and just take a magic pill or get a magic surgery to cure their obesity. And so it's the exact wrong message, especially when we have a country where 1 in 5 children are categorically obese.
Yeah, and the guidelines urge early treatment options at the highest available intensity. That is pretty strong language and really aggressive, I think. What does this suggest to you about the gravity of the situation regarding kids and obesity in the United States? And let's also talk about some of the health risks that do come hand in hand with obesity.
Well, it does signal that more people in this country are really starting to take this issue seriously. I mean, children obviously take the habits of their parents, and we have a population where if you are at a metabolically healthy weight, you're in the minority. About 70% of the population is overweight. More than 42% of the population is categorically obese. And so it's really no surprise that 20% of those aged 2 to 19 are obese, and especially the lockdowns really exacerbated these trends. The rate of type 2 diabetes doubled for children. The rate of BMIs doubled for children over the lockdowns. And so what we've done is we've created an entire generation of metabolically unhealthy people, and everybody's just getting sick. We have a toxic food supply, and the end result is a generation of obese individuals who aren't living up to their full potential. And so what we're doing is we're medicating all the symptoms of obesity, but we're not dealing with the core issue. These medications carry themselves with their own side effects, from nausea, in some cases extreme vomiting and extreme fatigue, to rid these people of obesity. And of course, you give a 13-year-old bariatric surgery, you're creating a lifelong medical patient. And so Big Pharma profits, and the individual still suffers as a result.
Yeah, and many times, well, I shouldn't say many times, so oftentimes children do grow out of things, as they get older. I've seen it in my own family. They kind of thin out with diet and exercise. But of course, as you mentioned, there are also contributing factors like screen time and also being on their other devices all the time. Let's talk a little bit more about that, and also psychological issues that really weren't mentioned either when it comes to being overweight and obese.
Absolutely. The issue is not actually that as complicated as people make it sound. I think the country just needs to go back to basics and take kids, get them off their phones and throw them outside, get them active, and get them eating healthy, get them eating whole foods. Parents should shop on the outskirts of grocery stores and not in what a lot of people call the fun aisles with Oreos and all these processed foods. Walk down the cereal aisle at Walmart and try to pick out a healthy cereal. It's just amazing what we're advertising to children. And of course, the store is really smart about this. They tend to show the sugary cereals at the eye length for children, and so the children then bug their parents to buy it for them. So no, what we need to do is just go back to basics, get the kids off their phones and put them outside. It helps them be social, and it gets them active into the healthy lifestyle that then they'll carry with them for a lifetime.
Interesting. I want to bring something else up. I mean, you mentioned about the health risks when it comes to the surgeries and also the pills that go along with this. Doctors, part of the Hippocratic Oath is to do no harm. And you mentioned some of the things that may go along with the adverse effects. Can you talk to us about that and why they're pushing this?
Well, I think a lot of doctors think they're doing no harm. I think a lot of doctors think they're actually doing the right thing, but the doctors have also been trained by Big Pharma, by the people in the big food industry. And of course, they're all in cahoots with big government. And so I think a lot of doctors have been misled, and they continue to go down this rabbit hole of prescribing medications that really just treat the symptoms of disease and really rarely, never, ever the disease itself. And because, I mean, treating a disease makes Big Pharma a lot more money than actually curing disease. And so I think doctors think they're coming with good intentions, but I think the end result is really contrary to the Hippocratic Oath.
Just a few seconds left. Really quickly, final thoughts.
Well, I think this country just needs to go back to basic: eat whole foods, eat whole, healthy foods, and get outside and be active.
Great. Tristan, thank you so much for your insights. Appreciate it. Great to be with you.
Thank you for having me.